Home health care is a rapidly expanding industry. As healthcare providers strive to reduce healthcare costs by decreasing hospital length of stay, patients are being discharged sooner, or they're receiving services and surgery on an outpatient basis. Hi, I'm Kathy Getrust. I'm an instructor in community health, and today we're going to be talking about caring for patients in their home. Most people are happier and more secure if care can be provided within their own home. The definition of home care is care that is provided in a person's place of residence. This might be short-term, intermittent, skilled care. It might be rehabilitative care where someone needs to come into the home, such as a physical therapist, and do some muscle strengthening exercises after a fall. It might be long-term supportive care where a home health aide would be coming in to assist with activities of daily living, such as assisting with feeding, toileting, grooming, dressing, those kinds of things. Or it might be end-of-life hospice care that would be provided in the home. The trend, however, is for home care. It's growing not only because hospital patients are being discharged sooner, but also because people are living longer, and technology is allowing patients to be living much longer than ever before, as well as the population is growing. Home health care is really a unique field. Care is provided in the patient's home. Now, we think of a patient's home as being a freestanding residence, but it can be a senior apartment complex that you might be giving care. It could be a group home. It might be an assisted living facility where the individual is. So the patient's residence really varies greatly. Care in the home is also done, but with the family, and friends sometimes are there along with the patient, and pets. So it's very different from long-term care or hospital care in that regard. Patients and families in the home make the rules and set the standards. That's really an important thing to remember in home health care, that we as caregivers are their invited guests and need to respect them and their place. There are a variety of types of home health agencies. Some are privately owned, for-profit or non-for-profit. Some are publicly operated health departments. Probably the ones that you're most familiar with are hospital-based home health agencies. Most large hospital systems nowadays have an arm of their organization which is a home health agency. There's a variety of services that can be provided in home health. Might be private duty care. Private duty care could be housekeeping responsibilities, might be personal care, might be a companion that's required. Sometimes a family is caring for a patient and they want on a weekly basis for a companion or a homemaker to come in and do some light housekeeping and read to the patient so they can get a break from their caregiving responsibilities as the family member. Another type of service that's provided in the home is what's called skilled care. Skilled care means that the care is provided by professionals in health care. It might be a registered nurse, or it could be any variety of therapists, such as physical therapists, occupational therapists, and the like. Skilled care would be things such as a patient who was newly diagnosed as a diabetic and might need some instruction on how to manage that diabetes, as well as sometimes the family needs to be made aware. They might also be needing instruction on how to administer insulin. This would be professional services that the nurse would provide. Another type of skilled service might be wound care. The nurse would be coming in and assisting with wound care management for an individual. Another kind of service that can be provided is hospice service, and that again is an end-of-life service when a person is nearing death and they have chosen to remain at home to be able to die in their own environment. Sometimes it'll be the nurse that comes in, could be you as a home health aide, might be a chaplain or social worker as well. There's a variety of reimbursements for home health services. Medicare and Medicaid typically will pay for skilled services. Those are the services I previously mentioned where there is a professional nurse or a therapist that's coming in to do some skilled care. There might also be some private insurances that will pay for home health services. For some services, particularly the private duty companion type of services, would be taken care of by the client's own personal funds. Typically, insurances and Medicare, Medicaid do not cover that particular companion service. There are a wide variety of people involved in the home health care team. Besides the patient and family, you have professional nurses, nursing assistants, therapists, sometimes occupational or physical therapists, physicians, social workers, homemakers, and others. There are some real advantages and disadvantages to working in the home health field. Some of the prime advantages are that you have the satisfaction of being able to provide complete patient care. In the hospital, or sometimes in the long-term care facility, you may be doing a portion of the patient's care, but you are able in the home setting to do much more complete care to them, from assisting with meal planning and preparation, to shopping, to light housekeeping, to activities of daily living. Another advantage is you have the opportunity to build up a really close relationship or a strong rapport because you are providing for patients in the home over time. Even though in a hospital and long-term care facility, great effort is made to have consistency in caregivers from day to day, that is not always possible. In the home, you will be seeing the same patients typically for an extended period of time, and it allows you an opportunity to get to know them well. Another advantage is that you have the opportunity to work with greater independence. Of course, in the hospital or long-term care facility, you as a nursing assistant would have much more oversight by a professional nurse